This video is to talk about the pelvis bones, ligaments, and the nerves, the anatomy including the pudendal nerves and the branches of the pudendal nerve, as well as other nerves in the pelvis. It's an important, helpful video for those suffering from pudendal neuralgia, pudendal nerve entrapment, and other similar nerve pains in the pelvis and the thigh. First, you have to know about some basic anatomy terms that would be helpful to know about them. Posterior equals the back side or back view. The way I remember it is good posture is good for your back, or post is another name for the back. So anterior equals the front side, inferior equals the lower part, superior equals the higher part or higher view, lateral equals the part of the body or structure farthest away from the center of your body. Medial equals the part of your body or anatomy closest to the center of your body. Superficial equals the area closest to the skin. So it's opposite of deeper part of your body, area closest to the skin for superficial. Distal equals the part furthest away from the origin or furthest away from the beginning of a nerve or any other part. Deep nerves, I was confused about this at first, thinking deep meant it was deeper part, but actually deep nerves actually are nerves that supply muscles. Rami equals the branch of a nerve or bone. Varices are enlarged veins, and the Alcock's canal is the pudendal canal, and the pudendal canal is actually basically it's a part that's encased. It's an encasement of your pudendal nerve. Basically, it's like a tube that surrounds your pudendal nerve, and it's in between your sacrotuberous sacrospinous ligaments. Okay. Next, I'm going to talk about the pelvis bones. Okay, one correction I want to make is that the pudendal canal is actually located after the sacrospinous ligament, closer to the perineal and dorsal branch of the nerve. And it's not located in between the sacrospinous and sacrotuberous ligament, but it's located after the sacrospinous ligament. Okay, some important parts of the front anterior view of the pelvis that you should be aware of are okay, the sacrum is basically the middle part of the pelvis, and then on each side, the left and the right side of the sacrum, there's they're called the ilium, the left ilium and the right ilium. It says iliac fossa there, but it's just a part of the ilium. This whole big thing there is the right ilium. Next thing is at the very bottom there, you'll see something called pubic symphysis, and this is basically where your pubic bone is. It's basically right above your genitalia area. Your pubic bone is right there above that, and you'll see something called the ischiopubic ramus. This is another kind of important thing. That is basically where the ischium and the ramus kind of join together there. And then you'll see another part on the left side there called the ischial spine. That's very important. It's important because that's the area close to where they usually inject the pudendal nerve block from the back, because the ischial spine is right there, real close to where the sacrotuberous and sacrospinous ligaments meet, which is also where the part of the pudendal nerve path runs along. Okay, next we're going to talk about the back part of the pelvis, or also known as the posterior view of the pelvis. Okay, in the back part of the pelvis, or also known as the posterior view of the pelvis, there's so important parts. You can see the cox bone, which is basically your tailbone. Uh, and then you can also see the sacrum there, the back view of the sacrum, which is the middle part of your pelvis. You can see the left and right back parts of the iliums, which connect to the sacrum. By the way, the part where the sacrum and the iliums connect together is called the sacroiliac joint. Um, Also, okay, at the bottom there, you can see where it says ischial tuberosity. Keep in mind, this is the back view of the pelvis. Ischial tuberosity, another name for that, is basically your butt bone or sitting bone, the part you put the most weight on when you sit. And then you can also see right to the left of there the ischiopubic ramus, which is basically another word for the area where your ischium connects to the ramus part of that part of the pelvis. And you can see in the middle there the pubic symphysis. And the ischial spine is also seen there, which again is where it's close to where um, they inject the pudendal nerve block. Uh, okay, this picture shows your pelvis connected to your spine. At the top there, you can see that's your vertebrae, your spine connected to your right to your sacrum, and in the middle there. And then right to the left there, you see the word ilium. That's the left ilium, and on the other side of the is the right ilium. And where your sacrum and your ilium meet there, where they connect to, is called the sacroiliac joint. You can see also the cox bone at the very um, near the bottom of the sacrum. That's also called the tailbone. And this is also the posterior front view of the pelvis. You can see the pubis bone there. And also right below that you see the ischium bone. Now basically right where the pubic symphysis, that blue part in the middle is, right to the left and right of there is called the uh, pubis ramus. It's basically a branch of the pubis. But that area is very close to your dorsal nerve area, dorsal branch. Um, that's called again the pubis ramus bone area, or pubis branch of the pubis bone. Right there to the left and to the right of the blue part in the middle there, which is that blue part is called the pubic symphysis, or pubic bone area. Um, and it's kind of felt a little bit when you sit in that part. It's like your front part where you sit, as opposed to like the back part where you sit, where it's called the ischial tuberosity or sitting bone. Um, okay, now we're going to talk about the bones of the pelvis, uh, more in detail. The sacrum, ilium, ischium, number three. Number four is going to be the ramus. Number five on the diagram is the pubic symphysis. Number six on the diagram is the acetabulum. An acetabulum is basically where your hip socket is, where your basically your hip bone connects to your pelvis. Seven is the obturator foramen. Foramen means opening, by the way, so it's the opening for the obturator and the membrane. Okay, before we discuss this next part, I just wanted to mention that I incorrectly said that part number four was the ramus, where it actually is the pubis. I meant to say that it's the pubis, not the ramus. Um, Ramus is just a branch, and there's a pubis ramus branch, which is actually a branch of the pubis, which is more inferior and medial located towards your area of the dorsal nerve. So, anyways, I just wanted to let you know that during this presentation, when I say that number four is the ramus, just note that it's actually the pubis and not the ramus. Okay, so this is the front anterior view of the pelvis and all the bones of the pelvis. Okay, number one, start with number one, is called the sacrum. It's in the middle, and this is not listed on there, but in between number one and number two, again, is the sacroiliac joint, which joint means it connects those two bones together. Number two is the ilium, so sacroiliac joint. Uh, so number two is called the ilium. Number three is called the ischium. And we get the word ischial tuberosity because the ischial tuberosity is made up of the bottom back portion of the ischium. And number four is the ramus, which is, you can see, it's a pretty large portion of that part of the body or pelvis there. The uh, the pubis ramus, which is a branch of the ramus bone, is actually the part more towards the middle, towards part number five in there, which is a pubic symphysis, and it's also again a part where it is very close to where your dorsal branch of the nerves are. Number five is the pubic symphysis. Six is acetabulum, which is the hip socket joint for your hip bone, thigh bone. Seven is the obturator foramen and the membrane. Okay, next we're going to talk about the back part of the pelvis, or it's the posterior view of the pelvis, uh, including, importantly, the sacrotuberous and the sacrospinous ligaments of the pelvis. Okay, now we're going to talk about the rear view or posterior view of the pelvis and the ligaments of the pelvis for the female. Pretty much the same as a male. But, anyways, the main ones you want to know about are in the very bottom right corner. You can see an arrow pointing to the sacrospinous ligament with the dotted line there. going straight to the sacrospinous ligament. Uh, the sacrospinous ligament basically attaches at the point of the pelvis we talked about before, called the ischial spine, um, and and right where it crosses, you can see another big ligament going from the very bottom of the pelvis to the top, and that's called the sacrotuberous ligament. So right where those two cross over is, you know, where the pudendal canal is, and where they will cut, especially for the transgluteal approach, to be able to see if there's any entrapment there and to visualize the nerve the best. On the left side, you can see the arrow pointing to the sacrotuberous ligaments, just so you're sure and where it originates and where it goes to. It goes all the way from the bottom there of the ischial tuberosity or ilium part of the pelvis, all the way up to the top of the ilium there. And those are the main things that you want to memorize and know for this. Okay, now we're going to talk about the front view or anterior view of the pelvis, which will include, importantly, the sacrotuberous and sacrospinous ligaments. First, look at the mid-right part of the pelvis. You'll see it labeled with a yellow saying sacrospinous ligament, with the arrow pointing to the white part. And right to the right of that white part is the ischial spine, which the sacrospinous ligament comes off of the ischial spine. And on the left side, you can see it shows you the labeling for the sacrotuberous ligament. And you can see on the left side of that, it shows you both the sacrospinous and the sacrotuberous ligament. You can see how close they are together. And the pudendal nerve basically travels right underneath between those two ligaments. So, one way it can be compressed is, because there's too tight a space between those two ligaments. That's actually the most common cause of compression of pudendal nerve entrapment, is being too tight of a space between those two ligaments. Let's see what else. You can see the pubic symphysis in the middle lower portion there, or also your pubic bone. Of course, the sacrum, and the left and the right ilium. Okay, now this is a picture I'm going to show you of the entire spine, the vertebrae, which includes starting from the top, the cervical part of the spine, and then the thoracic part of the spine, and then the lumbar, which is the lower back part of the spine, and then the sacral, which is basically where the sacrum is for the sacrum, and the sacral area is actually where all the nerves for the pudendal nerves and its branches originate from, the sacrum and the sacral area of the spine. Okay, now we're going to get to the fun part, the important part, talking about the actual nerves themselves, the peripheral nervous system, which are, basically the nerves that are not part of, they're separate from the central nervous system. Central nervous system basically is your brain and your spinal cord, and then your peripheral nervous system is the nerves that go from the spinal cord to the parts of your body. So we're going to talk about that and all the different nerves in the pelvis. Okay, here you can see the let's see where we're going to start. Let's start from the important parts. Start from the genital femoral nerve, which is in the left side. You can see the name of that there, pointing to the genital femoral nerve. Genital femoral nerve means it goes to your genitals and to your femur. Femur is your thigh bone, so it goes to both, branches off into both. And it actually goes on through the back part of your body, through your ischias muscle, right on top of that muscle. And the genital femoral nerve, once it gets to the posterofemoral branch of that nerve, it also it branches off into something called the inferior cluneal nerves. And basically the posterior femoral cutaneous branch of that nerve will affect your thigh, the back posterior part of your thigh. You'll feel pain there. Next most important one listed here, of course you can see your pudendal nerve there, very small. This is just the back part of it, so it's just showing where it kind of, the root of it is where it starts out from your spine. Then the next important one is your sciatic nerve. Now your sciatic nerve basically goes all the way from your lumbar back area all the way down to your feet, all the way down your legs, your feet, your thighs, your pelvis, everywhere down your feet. Okay, now we're going to talk about probably one of the most important parts of this whole thing for all of us, and the most confusing parts and the most important part, basically, as far as narrowing down where your exact entrapment location is at, and which doctor you need surgery for, and which kind of symptoms you're going to have. Basically, it's the pudendal nerve. Basically, the main nerve in your pelvis and its branches. The three different branches of the pudendal nerve are the rectal branches, which supply the rectal area, which if you have a entrapment just in that location, you should have some kind of problems going into the bathroom, making it harder to go, like constipation and some pain in that area. And if you have entrapment in that location, you can also have other symptoms that go throughout the rest of the pudendal nerve, including the perineal and the dorsal. So it can also affect your urination and your genital area if you're entrapped at the rectal branch. The next branch is the perineal branch. The perineal branch, and then the next one is the dorsal, which goes to your genital area, and then the pudendal canal, which pudendal canal is also known as the same thing as the Alcock's canal. And we'll also talk about the sacrospinous sacrotuberous ligaments and the ischial spine. Okay. Alright, starting from the very origin of the pudendal nerve, you can see where there are four nerves that are going into the sacral part of the spinal area. That's where it all starts, basically. All the nerves start from there. And then that's basically it turns into your pudendal nerve. And you can see the sacrospinous ligament there, as well as the sacrotuberous ligament. And also the pudendal canal, uh, the inferior rectal nerve, which, like I said before, your rectal nerve would cause you to have problems with constipation and pain in your rectum area, as well as it would also radiate to other areas such as your genitals and your perineum area. Um, so that would affect more than just your usually affect more than just your rectal area. Then there is the perineal nerve, which is another branch of the pudendal nerve, and that perineal nerve really affects more of just the perineum, hence the name perineal, which is basically more like the area in between your um, your anus, and your right below your genitals, that area of skin right there. Um, also supplies your bulbal spongus muscle, which is also right there, which you will see later on. And also that perineal branch will also supply your posterior scrotal nerves if you're a man. Um, and another branch is the dorsal branch, um, which is basically as far as the bones goes, right along your pubis ramus bone area. And it is actually at the kind of right for man, it is right below your um, it starts, further down below your genitals, below your scrotum, and it goes all the way up into your penis. So some people, even doctors, think it's just in your penis, but it's not. It goes actually further out and down outside of the penis. So, and one more thing I just want to mention is that um, now, if you only have problems with pain in your um, genital area and like urinary problems, frequency, urgency, and pain in your perineum, you don't have any rectal problems, like no problems with constipation, no pain, around your rectal area or rectum, then likely your rectal branch is not entrapped, and it is somewhere, in another branch, either, in your at your Alcock's canal or your and further down along towards your perineal branches and your dorsal branches. Um, if it is um, if you have pain in your bulbal spongus muscle area, which is where your perineal branches go to, and your scrotum area and your base of your penis or penis area, then that is likely, and nothing else, then there's a good chance it could just be your dorsal and perineal branches of the pudendal nerve that are entrapped. It could be also entrapped inside your Alcock's canal, um, but definitely would not, be where the rectal branches are. Okay, this is showing the different branches again of the pudendal nerve a little bit better. The let's see, you can see the ischial spine there, the pudendal canal, which is kind of highlighted in like yellow there. The inferior anal or inferior rectal nerve branch of the pudendal nerve, which supplies your rectum, anal area, buttocks area. Then there's the two parts of the perineal nerve. One is the deep perineal nerve, and that one actually supplies your bulbal spongus muscle area, which is basically the central vertical area of your perineum. Goes all the way from your right above your anus to right below your scrotum or other genitalia for women. The superficial perineal area, for men anyways, is superficial, is closer to the skin. So that part, those nerves go closer to the skin, but also they supply the scrotal area, your scrotum, your testicle area. And then you can also see in the dorsal nerve of the penis, which is really, really close to the perineal nerve. And both of those are also right there, right next to the pubis ramus part of the pelvis. You can also see the sacrospinal nerve roots there. And that's off of that. Okay, this is a close-up picture of the pudendal nerve, and it also shows the sacrospinous and sacrotuberous ligaments. The sacrospinous ligament basically runs horizontal, and the sacrotuberous is a wider ligament that runs vertical and is longer. It runs from the bottom of your pelvis to the top. And you can see how the pudendal nerve is right in between those two ligaments, and why they will have to cut those, at least one of those ligaments, in order to be able to access that nerve, and free it and see what is causing the entrapment. You can also see in there the piriformis muscle and the inferior gluteal nerve. Okay, in this picture you can see part of your lumbar spinal area and your pelvis. Now L4 and L5, you can see the yellow nerves coming from them, and that's basically your femoral nerve. And you can see at the bottom there it says posterior femoral cutaneous nerve. So that comes all the way from your lumbar part of your back. Um, you can also see the inferior or basically the lower gluteal portion of the pudendal nerve. Um, and you can see the S1, S2, S3, S4, S5, and the middle part where the sacrum is. This is these are the holes, also known as foramen, where the nerves come through uh, to become the pudendal nerve and its branches. Let's see what else. This is the frontal view, anterior view of this pelvis. You can also see in the bottom left there, right next to the posterior femoral cutaneous nerve, you can see the sciatic nerve, um, which supplies the entire leg. It's pretty close to the femoral nerve, so um, you can imagine if you have some kind of a compression affecting the posterior femoral nerve close to that sciatic nerve, you could also have pain going all down your leg, not just your thigh. I guess that's it for that. Okay, now we're going to talk about the male anatomy and the nerves. Okay, the main organs and body parts for the male are we have the bladder in the middle there with the pink, and then the pubic bone, which is right above the male genital area, and there is the prostate, and the prostate is right below the bladder, and basically the urethra starts from your penis, goes all the way through your penis, and goes actually through the prostate and into your bladder. So that's why whenever some people have true prostatitis, bacterial prostatitis, it can compress uh, the urethra, making it harder to pee and stuff. Um, and then you can, of course, see the other areas of the penis, the urethra, which is the inside of the penis where the urine flows, and the testes, which is in the scrotum area of the man. And then there's a spermatic cord, which carries the sperm on the testes. And you can see the rectum, the spine, seminical vesicle. Okay, here's a more detailed anatomy picture of the male. I guess I'll just cover some of the more important parts. Let's start at the top right. There's the part pointing to the urinary bladder. There's a big pink area there, right above your pubic symphysis bone. And then, let's see, there is the prostate, which on the diagram here is the purple colored looking part of it. Also, there's, of course, the anal canal. And then going on down to the bottom there, you see the testes, and then it says the head of epididymis, but it's actually just epididymis is all you need to worry about, which is the part behind your testes or testicle. And whenever you hear the word epididymitis, it means the epididymis is inflamed, irritated, and painful. And it's non-bacterial or bacterial. Trauma can cause non-bacterial and other things as well. And you can see basically the penis, the glands, the penis, the spongy urethra, pubic symphysis, or also known as pubic bone, right above the penis is where the top of it is. And those are the main parts. Okay, here's just another drawing showing comparisons of the pudendal nerve and its branches, actually done by two pudendal nerve surgeons, Dr. Robert and Dr. Vico. You can see the ischial spine, which is right where the sacrospinous ligament attaches to, and also where you can see the pudendal nerve runs underneath that area. And then it travels to the pudendal canal. I may have said before that the pudendal canal was in between the sacrotuberous and sacrospinous ligament, but it's actually a little bit past the intersection of the sacrospinous and sacrotuberous ligament. You can see the ischial tuberosity. Okay, this picture is showing a close-up of basically the sacrum. You can see we're out of the three holes, also called foramen, and the sacramen, where the three different nerves come out. S2, S3, and S4 come out and form together the pudendal nerve. And you can see how it kind of curves right underneath the sacrospinous ligament there. Okay, this is a good, important picture for any of those who feel like they have a dorsal branch of the pudendal nerve entrapped, showing the pubic ramus or pubis ramus part of the bone, pelvic bone, and you see the yellow nerve right next to it there. That's actually the dorsal nerve, and you see how close it is to that part right there. And the blood vessels and the nerve together there is called a pubic or pubis ramus tunnel. And you can see also the very top there, the pubis symphysis or pubic bone. And in the middle, you can see the urethra. Looks like the urethra sphincter there. And the urethra there. So that's pretty much the main part I want to show you in that. Okay, this is a close-up view of the pudendal canal, which you can see on the right side there, labeled. It has two dotted lines, kind of showing you the path of where exactly it's at. And can see also in the very middle of the picture the anus, to kind of give you an idea of where it's at. So it's kind of to the right of the anus, far right to the anus, but it's also kind of, pretty fairly deep. So that's pretty much the position that the pudendal or Alcock's canal is at. Okay, now we're going to talk about a lot of different important nerves of the perineum in the male. Starting in the top left there, you see the posterior um, scrotal nerves, uh, and then you see below that the superficial perineal nerves, superficial meaning closer to the skin or outermost part. And those superficial perineal nerves actually go, you can see it going, it looks like it's going to the, where it goes to the right there, branches to the right, to where the penis is. That's actually the bulbospongous muscle there. Um, and it's actually called when it goes to that part, it's called the deep perineal nerve. But deep actually means it goes to the muscle. Um, let's see what else. There's also the dorsal nerve of the penis on the right side, you can see. Right to the right of the bulbospongous muscle, you see what's called the dorsal nerve of the penis. It's a yellow nerve there, but it has some uh, red around it, so you can see it a little better there. And you can see how it's right alongside the bulbospongous muscle, and how it is actually in the path of the adductor muscles, which connect to your pelvic bones, your pubis bones, uh, and that is another way it can be compressed or entrapped is from your actual adductor muscles in that area, or scar tissue, or varices, different causes. Um, okay. Also, let's see here. I'll try to find something else here to show you. You can see how on the very right part where it says dorsal nerve of penis, how far down exactly that dorsal nerve goes. I mean, even outside of that bulbospongous muscle, it's still going pretty far down, close to the rectum there. At which point it actually gets close to becoming the branch of the pudendal nerve called the perineal nerve. You can see the perineal nerve there, right below and to the right of the dorsal nerve. And both of these branches of the pudendal nerve, dorsal and the perineal, whether it's the deep perineal nerve or just the perineal nerve in general, both of those are outside of the Alcock's canal. In other words, not inside the Alcock's, but rather outside of the Alcock's canal, which the outside of the Alcock's canal is what people refer to a lot of times as the distal Alcock's canal. So it's the distal part of it, meaning the furthest part of it. So it's actually outside of the distal Alcock's canal. Those two branches there. Okay, so then you can see right below the perineal branch, you can see where it's labeled the pudendal canal, also known as the Alcock's canal, and it's opened up there. So you can see it's normally encased with with some fascia, which they have to kind of cut to get through into the Alcock's canal. And you can also see the main pudendal nerve branch there on the bottom right below the pudendal nerve. or pudendal canal. And you can see how it has different branches. You can actually see, I don't think it shows it, but it actually shows it shows it on the left side actually, but they're the inferior anal rectal nerves, which is another branch of the pudendal nerve. So it's branching to your anus area. So if you're entrapped in that area, you're gonna have some problems with constipation, some pain around your anus, and it actually will radiate sometimes up into other areas. So something to keep in mind there. You can also see on the left side the inferior cluneal nerves, which can kind of mimic, for some people, pudendal nerve entrapment or pudendal neuralgia. But the inferior cluneal nerves are actually a separate nerve that branches off your posterofemoral nerve branch. So it's like a totally separate nerve from your pudendal nerve. And this will basically mostly affect your superficial or outermost buttocks area skin only. And it does go down to like your sitting bone area as well as your whole entire buttocks area. So that's something to keep in mind there. I'm trying to diagnose and figure out exactly which part are you entrapped at and which your pains are. Keep in mind all your pain locations in relation to your symptoms you're having. Okay, this is showing the dorsal nerves of the bowel, right alongside the pubis ramus bone, inside the pubic ramus bone, tunnel. You can see that on the right kind of side there. And also you can see the perineal perineal nerve going to the bulbal spongus muscle area, which is basically right there above the anus, going from there up to right below the scrotum area. That's basically the bulbal spongus muscle. So the perineal branches will supply that muscle. It's actually the deep perineal branches. Deep meaning supplies muscles. Okay, the nice part about this picture showing you, indicated with the yellow, is exactly where how deep it is, your pudendal Alcock's canal. You can see, where the anus is in the rectum. You can see in relationship to that, where your pudendal canal, Alcock's canal is. So it's not like it's right there on the surface. It's further deeper inside your body there, to the right or to the left of the anus, depending on which side you're looking at. Okay, now I'm gonna cover a lot of different other nerves, and this is the male front anterior view of the lower abdomen and pelvis area of the nerves, and I'm just going to go over that, but it's pretty similar for the women as far as some of these go, but I just wanted to go over these. First, I'm not going to go over all of them, but just some of the main ones. Let's first talk about starting with the genital femoral nerve, which you can see is the name of it is is located at the top left. Um, Genital femoral nerve has an arrow pointing to the one long nerve there, which is actually on top of the psoas muscle there, and it goes down, and then you can see it branches off into two separate branches. One of those is the genital branch, and one of those is the femoral branch. The genital branch goes to the genitals. The femoral branch goes to your uh, uh, femur or your thigh area. Um, and right next to that, you can also see the femoral nerve to the left of that, at the bottom there. And there's the lateral femoral cutaneous nerve also to the left of that. And then going down at the very bottom, you see the anterior scrotal branches of the ilioinguinal nerve. There's also the ilioinguinal nerve, which is involved in some hernias, and there's also the anterior branch of the iliohypoglossal nerve, which is very close to that other just close to the other nerve there that I just mentioned. So it's lower down. The iliohypoglossal nerve is lower down. And to the right, you see at the bottom right, you see the obturator nerve, which goes to your obturator. And then up above that, you see the pudendal nerve, S2, S3, S4. Those are coming out of those three holes there. S2 is at the top, S3 is the middle, then S4 is at the bottom there. And those are your main branches that of the sacrum part of the spine that actually come together to form the pudendal nerve, as you can see there. And those branches of nerves there before it comes to the pudendal nerve is actually called the sacral plexus. Okay, to the right of that you see the femoral nerve again, and then you see the obturator nerves again. Then going up you see the genital femoral nerve and its branches going on the right side of the body where the psoas muscle is there. And it's very interesting. You see, even above that, you see the genital femoral nerves going all the way up there, even to where the lumbar part of the spine is. Seems pretty high up here. So, but the genital femoral nerve, its origin is actually from the lumbar or the lower back spine. That's where it starts from. And you can see the ilioinguinal nerve to the right top of that, and then the iliohypoglossal nerve. So those two nerves will also originate from your lumbar spine area. And you can see the psoas major, which is just another word for the psoas muscle, which is where the genital femoral nerve is innervated and also is on top of. And then you can see the ilioinguinal, iliohypoglossal nerves again also. Okay, now I'm going to go over the some of this, just one specific area of a diagram we've already went over, but it's highlighted by the blue, called the bulbal spongus muscle, which is in the females and males, which is basically located in the central vertical part of your perineum, right above your anus to your right below your genital area. And this specific area is actually innervated by the deep perineal branch of your pudendal nerve. Deep just means it goes to your muscles, so that's what deep means. So it's basically just another branch of the perineal nerve, which is also basically just another branch of the pudendal nerve. All you need to worry about is basically your perineal nerves do go to your bulbal spongus muscle, which is actually um, pretty superficial as far as where it's located. Close to your skin, you can actually kind of feel it, the muscle there and the nerves, if it's especially if it's in pain from the perineal branches or someone else compressing it. It'll be very tender there. Um, so I just wanted to emphasize that because that's where my main area was, and if you do have some entrapment there or varices there, then that can definitely cause some problems there. Okay, this part here is the male nerves and blood vessels, veins in the perineum and pelvic area and genital area. The front anterior side or view of it is also very similar to a woman, but just opposite gender and different genitalia. But it looks complex here because basically it's showing the veins and the nerves together. So it looks more complex because of that. But you have to remember that the veins and the nerves, the blood vessels and the nerves are usually right there, right with each other, because the blood vessels supply blood flow to the nerves, which is important to keep them alive and going and functioning well. So that's something that's good to point out here with this diagram, is just to show you how a lot of the vessels, blood vessels and nerves are all right there together. Starting from the right side, you can see the posterior scrotal vessels and the nerves, top right. And then you can see the perineal vessels and nerves, which go to the bulbal spongus muscle area, which is a central vertical part of the perineum. And then you see the superficial transverse perineum muscle again, which goes all the way from the right side to the left side of the pelvis, right above the anus. And then you see the pudendal canal at the very bottom right there, which is a little bit deeper as opposed to superficial in area. And you see the inferior rectal or the lower rectal vessels and nerves coming off of the pudendal nerve. Then anal sphincter, the levator ani muscle, which is like a pelvic floor muscle. Then you see the inferior cluneal nerve on the left side, which is the lower cluneal nerve, the pudendal nerve. And on the top, kind of the left area, you see something called the central tendinous point of the perineum. That is again the area which is basically where all the different things come together and connect there, which includes your superficial transverse perineal muscle, your bulbal spongus muscle, and other muscular parts come together to form that central tendinous point of perineum. And then you see the ischial cavernous muscle on the top left there, and for the male, the ischial cavernous muscle basically supplies blood flow during erection. It gets blood flow to that part of the body, the ischial cavernous muscle, on both sides of the penis, in order to help it to basically compresses the makes it to get an erection because it gets blood flow there. That's all you have to know. And then you have the anterior scrotal nerves and vessels. Okay, this is some important parts as far as the muscles of the perineum area and the pelvis area. Um, it's pretty similar to the woman, but just a little different. But uh, this is the front anterior view of the perineum and the genital area. You can see first the bulbal spongus muscle, which is basically like at the base of the genital area. It's right below this. Goes from mostly right below the scrotum area down all the way down to just above the anus area, and right in the middle there, right below the bulbal spongus muscle, you see something called a perineal body, which is a little point there, which basically connects your bulbal spongus muscle, the superficial transverse perineal muscle, which is that one long muscle going all the way across there, right above the anus, and the perineal body also, in addition to those two things, it connects um, uh, the external uh, anal sphincter and the levator inner muscles. So it all connects right there at that central tendinous point there called the perineal body. Um, Also, there's the ischio-cavernous muscle at the top left. You can see it there. Um, and then you can see the ischio-pubic ramus area there, which is where very close to where your both of these two parts are very close to where your dorsal uh, nerve branch of the pudendal nerve are. And keep in mind, that the ramus, uh, uh, I'm sorry, the pubis ramus uh, part of the bones, pelvic bones, is very close to where the dorsal branch is, as well as some of the ischio-pubic ramus. Uh, and there's the bulb of the penis, which is basically the bottom, very bottom part of the penis. Uh, Going over to the right side, you can see or actually, let's go down to the left side, bottom side. There's a levator ani muscle, which is like the part of your pelvic floor muscle. Um, and then on the right, you see the gluteus maximus muscle, which is your buttocks muscle. Then going up a little bit there, where your sit bone area is, you see the ischial tuberosity. Now we're talking about the female anatomy and the nerves. Female. Okay, these are some basic organs and parts of the female anatomy. Starting from the right side there, you see the sigmoid colon, which basically connects to your rectum and the anus. And going over to the left from the sigmoid colon, you see the ovary, which is that top uh, circular structure there. And then going down below the ovary, you see the uterus. And then further down, you see the cervix. And then the opening going out from there, the outer part is the vagina. And then going to the left of the vagina, you see the urethra. And then going up from that, you see the bladder, which is where the urine goes to. And then to the left of the urethra, you see the clitoris uh, and the pubic bone. And also at the very top there, you see something called a fallopian tube, which is right next to the ovary. Okay, now we're going to talk about the female external genitalia. Uh, First, starting from the very top, we have the mons pubis, and then right below that, we have the prepuce of the clitoris. Next, we have the glands of the clitoris. And then next, following that, is the uh, urethral opening, where the urine comes out. Next is the opening of the paraurethral ducts. Then the vestibule of the vagina. And then to the left and right part, we have the labium minus, and then below that we have the vaginal opening, and then the labium majus, and the hymen's caruncle. Then there's the opening of the greater vestibular gland, followed by the vestibular fossa, the frenulum of the labium, and posterior labial commissure, and then the perineal raphe. The perineal raphe is just like a line that goes, both male and female, goes basically from your anus all the way up to right below your genital area. It's just like a line where your skin connects together in the middle. And then the very bottom there, you see the anus. Okay, now we're going to talk about some female pudendal nerves, and also some different muscles and other parts of the anatomy. Starting top there, you see where it says bulbal spongus muscle again, and this is the area of the bulbal spongus muscle for the female. There's also bulbal spongus muscle in the male, which the deep perineal branch, or basically just another name for the perineal nerves, go to, and that is a major part of the perineum there, because that's the central part of the perineum, the bulbal spongus area. So a lot of the central part of the perineum is innervated with perineal nerves there. Okay, going to the left of the bulbus spongus muscle, there's the urethral opening, which is where the urethra goes into. Then there, to the left of that, is the labium minus. Then the vestibular bulb. Then the veins of the vestibular bulb. Then there's the dorsal nerve of the clitoris. Which is similar to the dorsal nerve of the male penis. This is a dorsal nerve of the clitoris for females. You can see how pretty far that branch of the pudendal nerve goes, and below that you can see the internal pudendal artery, and you can see in the bottom left there, the perineal branches, and the inferior clinical nerve again, and then the perineal, and the inferior rectal nerves. So the rectal nerves is the rectal branch of the pudendal nerve, and the perineal nerve is the perineal branch. And over to the right bottom side, you can see pretty much the same things that we just saw on the left side. Now on the right side, you see the ischial tuberosity there, which is basically the sitting bone area. Then above that, you see the superficial transverse perineal muscle. The transverse perineal muscle is basically like a one long muscle, that skinny muscle that goes the very bottom of the bulbal spongus muscle area. And is right above the anus and right below the bulbal spongus muscle. And it goes all the way from one side of the pelvis to the other. That's the superficial transverse perineal muscle. Then we have the urogenital diaphragm, which is basically, I believe it's a term separating the part of the urinary system from the other areas of the body, of the area below the urinary uh, areas. And to the left, you see the posterior labial nerve. This goes to the labia. And then you see the ischial cavernous muscle after that, followed by the posterior labial artery. So even though the anatomy is different in the female than the male, I mean, there's a lot of the same kinds of nerves and different muscles, like the bulbal spongus muscle and the nerves that supply that, and the same branches that are for the rectal part of the pudendal nerve are also there, and as well as the cluneal nerves that are separate from the pudendal nerve. And so there are differences, but there are also very similar things involved. Okay, now we're going to talk about the thigh muscles, the ligaments, and the nerves that connect to the pelvis. Okay, starting from the top, we have on the left top of the pelvis area, we have the ilium, which we've talked about before, and then going down to the right side, let's go all the way to the right, you see the pubis bone, and then the ischium bone, and in between the pubis and the ischium is the pubis ramus, which is the inner part of the bone there, which is close to your genital area. And then in the whole opening there, we have the obturator membrane. And let's see, then we have the pubocapsular ligament, and then the pubofemoral ligament. And basically, this is your femur bone connecting to your thigh bone. You can't see it here, but but where it connects to is called an acetabular joint. There's the head of the femur, which is the top part of the bone, and the iliofemoral ligament. Then there's the greater trochanter part of the femur bone, which is the part that stands out on the lateral edge of the bone. It protrudes there. And then in the bottom right there, that femur bone is called the lesser trochanter. Okay, now we're going to talk about some parts of the front view, or also known as the anterior view of your thigh and your pelvis and your lower abdomen, the muscles and some of the bones there. Starting from the top there's the psoas major muscle, which connects to your lumbar area of your spine, the lower back of your spine, and that's where the genital femoral nerve actually goes on top of that muscle and goes down all the way down. Next to that is the iliacus muscle. And then to the right of that, you can see the piriformis muscle, which is basically right near the right side of the sacrum there, and it goes through the area where the acetabular joint and the femur bone are, and wraps around. On the left side, you see the tensor fascia lata, and then you see this is the most important part, the adductor magnus, adductor longus, adductor brevis, and the gracilis. Those are all basically adductor muscles, which are muscles that are on your inner thigh side. They basically all pretty much connect to your lower pelvis bones, like your pubis ramus bone and your ischium, your pubis, the top of your pubis bone, near your pubic symphysis, and they're used for adducting, which means bringing your legs towards you. And the upper part of the adductor muscles, where they connect to your pelvis, um, there's a lot of nerves there, like the genitofemoral nerve, and there's some other nerves close by, like the dorsal branch of your pudendal nerve, your perineal branch. So, if you have an injury to the adductor muscle area, it can cause some nerve problems to happen in those areas. And one thing that could possibly happen is that the adductor muscles could cause scar tissue or entrap part of your dorsal branch of your pudendal nerve there. Okay, now we're going to talk about the legs and the types of nerves that are in those areas. Starting with the leg on the left in the picture, that is actually the front view of the leg, the anterior view. Starting from the top left in the pink there, you'll see it's called the lateral femoral cutaneous nerve. Lateral meaning side, femoral meaning your thigh, cutaneous meaning more of your skin. So it's the lateral femoral cutaneous nerve, all the way down from the top of your hip there down to where your knee is. And then in the green part right next to that, you see the lumbo-inguinal genital femoral nerve. So there's some branches of the nerve that innervate and go in that area. And then right next to that in the brown, you see the ilioinguinal nerve area. And then if you go down in the yellow section there's the anterior femoral cutaneous nerve. And then going down from that, right there, where the pink is the saphenous cutaneous nerve. And to the left of that is the perineal lateral cutaneous nerve. And then the let's go on to the right side of the right picture on the right side, which is actually the posterior um, or rear view uh, of the leg and thigh. Okay, starting with the pink section there is the cluneal nerves there. Um, and then to the right of that is the cutaneous branch of the iliohypogastric nerves. And the blue there is the I'm sorry. Actually, the yellow is the superior cluneal nerves. Posterior superior cluneal nerves is the yellow section. Misread that. And then in the blue section is the lateral cutaneous branch of the iliohypogastric nerves. And then the brown is the last thoracic nerve. Then going down on the right side of that, you see the pink, the lateral femoral cutaneous nerve. And then on the green part right next to that, you see the posterior or back view of the femoral cutaneous nerve. And then to the inner part of that, you see the anterior femoral cutaneous nerve. And then going down in the pink, you see the saphenous cutaneous nerve. And on the blue part to the right, you see the common perineal lateral cutaneous nerve. And those are the major ones I want to point out there. Also, just one more last thing. There's a lot of nerves and that can cause some similar problems as the pudendal nerve entrapment. There's the cluneal nerves, basically. Looking at the right leg there in the picture, which is the posterior view, you can see the buttocks area, and the superior cluneal nerves are. All the cluneal nerves are more so towards the outer or superficial part of your skin. So you have like in the pink, the middle cluneal nerve. Then you have the superior, which is the higher up part of the cluneal nerve, and the yellow. And those can cause some buttocks pain from sitting. If you have your cluneal nerve compressed or has a neuroma or something that's going wrong with it. Also, if you have some problems with your thighs, like your adductors, that's somehow causing other problems with your pudendal nerves or other nerves, you can have some radiating back posterior thigh pain right there, where it says posterior femoral cutaneous nerve in the green section there. And as well as some on the inside towards your medial part of your body, which is the anterior femoral cutaneous nerve. So I just want to point out that. Okay, now we're going to talk about the back of the thigh, also called the posterior view. We're going to talk about the posterior femoral cutaneous nerve and the inferior cluneal nerve. Okay, this is the posterior or rear back view of the buttocks, basically, and the thigh and the leg there. You can also, which is nice, see, the parts of the bones of the pelvis and the femur or the thigh bone. Um, you can see the ilium, which is the big part in the top there on the left, and then you can also um, see the um, ischium, uh, basically the ischial tuberosity kind of section part of the pelvis there. And to the left, you can see the the uh, the femur or thigh bone connecting to the pelvis. All right, and then okay, let's go ahead and go to the nerves. The two I want to talk about are the posterior femoral cutaneous nerve and the inferior cluneal nerve. Okay, basically the posterior femoral cutaneous nerve, um, that nerve comes all the way from your lumbar lower back spinal area and goes all from there all down through your pelvis uh, to your legs. And right before basically where it starts to branch away from the where it starts to go away from the below the pelvis bone, the ischium, you can see it branches off into another branch of nerves called the inferior cluneal. Inferior meaning lower. So you see the lower cluneal nerves there, and they're right there, basically where the ischium or the lower part of the pelvis is, and so it's definitely it goes to your buttocks also, and the skin part of it, the superficial part. So um, and that definitely is a cause sometimes of pain for people when they sit. And it could be the only cause, especially if they don't have any, pain in the perineum and, don't really have any constipation or other issues. There's just pain like in their buttocks area sitting. That's it. So those are the inferior cluneal branches of the nerve are basically just sensory nerves. So those can be taken care of with different surgeons by simply just removing them if necessary. If they're very painful and they have neuromas and are badly damaged and there's no saving them, they can be removed, because they're just sensory nerves there. So just wanted to mention that. Okay, this picture of the posterior back view of the leg, thigh. Um, just wanted to point out just a few things in this. At the very top there, you can see the first one. There's a superior uh, gluteal area, and then you can see a couple down. You see where it says posterofemoral cutaneous nerve, which we talked about before. And then we actually see something called the perineal branch, which basically does that perineal branch actually goes to the branches to the posterofemoral cutaneous nerve. So if you do have some pain in your perineal branch of your pudendal nerve, it's right there. Also, at the very bottom branch of it, it does branch out to your posterofemoral cutaneous nerve in the back. So, if you injure your perineal branch, you can also have some pain radiate down to your posterofemoral cutaneous nerve of your thigh and cause some back thigh pain. Okay, this is just another picture of your muscles of your uh, posterior or back part of your thigh where it connects to your pelvis. Just wanted to point that out. The adductors are very important. It can also be a source of compression or problems causing pain for your nerves. Okay, there's the adductor brevis, the pectineus. Uh, you can see the obturator nerve there also, and the adductor longus muscle. Those are all adductors. Um, more more medial to your body or inner side to your body that connect to your pelvis. And actually, this is actually the I'm sorry, this is actually the frontal view, not the posterior back view. This is the front anterior view of the body, and you can see, you know, where exactly these muscles are connecting to. They're connecting very close to your perineum is, and uh, your dorsal branch of your pudendal nerve are. So if you have adductor problems like I have, that's actually what more than likely has kind of either started my pudendal neuralgia or made it worse somehow, because each time I injured myself, I would have this adductor pain. So just wanted to point that out, and sorry about that, but this is actually the front or anterior part of the leg or thigh. Okay, this picture is actually the posterior or back view of the thigh muscles and the buttocks, muscles of the buttocks, as well as some other parts I'm going to point out here. Starting from the top is the iliac crest, which iliac crest is basically the outer edge of the ilium bone that we talked about for the pelvis, one of the major big parts of the pelvis. And then you can see the gluteus medius, which is basically part of your buttocks muscle there, and gluteus minus minimus, which are also parts of your buttocks muscles. And then below that, the piriformis muscle. To the left, you can see the sacrum, which is the part, the middle part, the bony part of the pelvis. It's in the middle. And the very bottom there, you can see the cox, which is right below the sacrum. There's another bony part there, and there's nerves that come out of those two parts. And then you see the obturator internus. The other important part is called the ischial tuberosity, which is basically where your sit bone is, and it's also very close to where your cranial nerves are. And to the right of that, you can see the big yellow nerve. That's your important nerves called the sciatic nerve, which runs from your lower back all the way down to your feet. So if you compress that, you can have pain all down your leg and feet from that. So it's a bad one to have compressed. And then you can see some of the adductor muscles there, adductor magnus, which are like your side flexing muscles, the inner side. Or think of it more as your inner side when you think of adductor muscles. And all the way to the left, you see the gracilis muscles, and then the biceps femoris, and then going down towards the knee, the back of the knee is the plantar, and those are the main ones that I wanted to point out. But this gives you a good idea here of exactly where the ischial tuberosity is at in relationship to all your muscles of your thigh and your buttocks and your sciatic nerve and other important kind of areas. Okay, this is a deep section showing a lot of different muscles and nerves and ligaments of your thigh and your buttocks and leg. First, I want to start out with showing you the most important part of this. I'm going to show you is the cluneal nerves. At the very top there, you see the superior cluneal nerves, which means the topmost part, uppermost part of the where the cluneal nerves are, and that is basically where your upper buttocks are. And you can see the iliac crest there at the top, which is basically the very top of the ilium bone. So you can see how, you know, the superior cluneal nerves go to the very top part of your gluteus, your buttocks muscles. Next thing I want to show you is the medial cluneal nerves, and it's to the left there. And medial means more towards the middle of your body, so those nerves are around your buttocks area, but more towards the middle part of your body. And then right below that, you can see something called the inferior, which means lower, the lower gluteal artery and nerve. And you can also see the posterior femoral cutaneous nerve close by to that. And that is basically it's your thigh nerve, your back thigh nerve. And if you go down further below that, you can see real close to that there's something called the inferior or lower cluneal nerves. So the cluneal nerves are pretty have a pretty wide area they cover for your buttocks, and the inferior or lower part of the cluneal nerves is right, like I said before, like right there where your scium bone is of your pelvis, your lower sitting bone is. So it basically wraps around that, and it does supply also the lower part of your buttocks area as far as any pain with that. It's possible you could have entrapment and one of your cluneal nerves causing pain in any of these areas. But diagnosis is the key, and ruling out things is the key. And there's that I know of. Right now, anyways, a few surgeons in the country who can help decompress the cluneal nerves or to remove them if necessary. Then you can see the adductor magnus muscle, the sciatic nerve, the tibial nerve, which supplies your tibial bone, which is lower down there. Close to your tibial is your lower bone that goes below your ankle, basically. And see on the right side of this picture, you can see the piriformis muscle with the line going to that, and the obturator internus muscle. And some more pictures of the adductor muscles. And then where the knee is there, you see the plantaris muscle. And okay, here's a front superficial view, or view closest to the skin, outermost area. Basically showing the thigh muscles again, the adductor muscles, adductor longus, gracilis pectinus, psoas major, uh, the patella, which is where your knee is, adductor magnus. Okay, this shows some arteries, veins, and nerves, uh, basically for your thigh and pelvis. Um, I guess you can see there how the femoral nerve, femoral artery, femoral vein are all there right together. And generally, just keep in mind that most nerves have some kind of a vein or artery right there alongside them with them. Which is why sometimes people have uh, varices on their MRIs. Is because if the nerve is compressed, you know, the vein is right there with it. So if the vein is also compressed, then it will be like a balloon filled with water where it will like balloon out, kind of like bulge out. Say like if you pinch a certain part of that balloon, it will make that other part bigger and expand. If it's like instead of being filled with water, be filled with blood. So that's one way of putting it. Um, Having said that, there are cases where the actual um, vein or arteries itself, or varices, enlarged veins, can actually be the cause of the compression. There's been a few cases where this has been the point, but so far, anyways, this has probably been the minority of cases versus majority. So it's usually the other way around, where there's a compression of the nerve, usually causing the varices or the veins to enlarge, versus the other way around. But having said that, there still are cases where it's the other way, where the where the varices are causing a compression. You also see the adductor muscle, adductor longus muscles there, and the also a superficial saphenous vein. There's also a saphenous nerve, I believe, and that this is by the way, the front anterior part of the view of the body, and you can see the saphenous vein is a kind of a vein that goes along the inner medial part of your thigh area. Okay, this is a frontal anterior view of the. It's also kind of an upper superior view of it, of the pelvis and the acetabulum, which is the hip socket joint where your hip bone goes, or thigh bone goes into your hip. Um, and You can see the obturator membrane, which is in that hole there, which is where your obturatus internus goes into, and in the middle there you can see basically it's the pubis bone on the right middle part of that. Um, you can see the obturator canal. Okay, this is the last part of anatomy I'm going to be showing in this, and with this you can see starting from the bottom. This is first of all, this is the back posterior view of the basically the hip, or the hip and the thigh bone, and the connection between the two. At the top of the right thigh bone, you can see the lesser trochanter, the very bottom there, and then at the top there, the greater trochanter. And then you can see ilium at the very top of the pelvis, and right below the word ilium there, and everything where the blue part is basically the part where the femur connects to your pelvis, which is like the acetabulum. To the left there, you can see basically it says spine of ischium, the same as ischial spine, which is again an important landmark for people when they get their pudendal nerve blocks. That's near the area where they do it. And at the very bottom there, you see it says tuberosity of ischium, another way of saying ischial tuberosity. And this is your sitting bone, basically. The very back part of your pelvis and the bottom part of your pelvis, the bone there, which does have some cluneal nerves around that area. Uh, so this concludes it, and hope you enjoyed it. If you have any questions, feel free to post any on here. Thanks. Okay, there's one more thing I forgot to mention. I just wanted to mention that there's three common areas or specific sites that are compressed as far as the non-dorsal branch. The two most common sites. The first most common site is in between the sacrospinous and sacrotuberous ligaments, where there is too tight a space there, and those two ligaments are compressing it, which is why at least one of those ligaments are usually cut. Second most common area of compression of the pudendal nerve for the non-dorsal branch is in the Alcock's canal. And there's multiple other causes and locations, but those are just the two most common. As far as the dorsal branch goes, that is another area of entrapment. Also, the perineal branch. Those two branches are branches that are outside of the Alcock's canal and outside of the normal areas that the traditional TG approaches at this time cannot approach, but rather have to be done by the dorsal decompression surgical approach to reach those parts of the outside of the distal Alcock's canal, going up to the perineal branch and the dorsal branch of the nerves. Sorry for the background music there. That's my son. Okay, in conclusion, I just want to state some of the possible areas and causes of pudendal nerve compression, entrapment, and neuralgia, some of which have been confirmed by different pudendal nerve entrapment decompression surgeons. Number one is compression of the pudendal nerve by fibrosis, which is scar tissue of part of the sacrospinous ligament. That was by Dr. Eric Bertrand in France. Number two is compression of pudendal nerve by scar tissue in the Alcock's canal, also stated by Dr. Eric Bertrand in France. Number three, compression of the pudendal nerve by the spine or sacral area, lumbar spine disc area. Number three, compression of the pudendal nerve by the piriformis muscle abnormality or piriformis muscle syndrome, Dr. Eric Bishop, France. Number five, compression of the pudendal nerve by the fascia or tissue of the muscle obturator internus, which constitutes the Alcock's canal or pudendal canal. Also by Dr. Eric Bishop in France. Compression of the pudendal nerve by being too close, too tight a space between for the sacrotuberous and sacrospinous ligaments. So, the nerve is in between the sacrotuberous and sacrospinous ligaments. So if it's too in between those two ligaments too tightly, then it can be compressed by those two ligaments. Number seven is the compression from dysfunctional state of the piriformis can generate a repeated hypertension of the muscle with hypertropia. Um, as a it can, as a consequence of the bony structure, can close the interligamentory grip in which the pudendal nerve passes. The pudendal nerve is already weakened at the level of the intrapiriformis. That was by Guy D. Bishop's Pierce. 8. Compression of pudendal nerve at the area of the pubic ramus tunnel, dorsal branch of the pudendal nerve. Dr. Lee Dillon. Compression of the pudendal nerve at the perineal branch of pudendal nerve, Dr. Eric Bertrand. Compression of pudendal nerve at the rectal branch of pudendal nerve. Compression of pudendal nerve by scarred tissue surrounding any area of the main pudendal nerve or its branches, or it can be caused by pregnancy, scarring due to surgery, accidents, trauma, surgical mishaps, bicycling, infection, and weightlifting. Usually it's either trauma or some kind of trauma or repeated trauma or some kind of pregnancy or surgery or unknown causes in some cases. Compression of the pudendal nerve can be caused by anatomic abnormalities, which can result in the different parts of the anatomy being fused together, compressing the pudendal nerve. Wikipedia, compression of the pudendal nerve being trapped between the sacrotuberous sacrospinous ligaments. Wikipedia, compression of the pudendal nerve by activities such as bicycling, causing thickening of the sacrotuberous and sacrospinous ligaments and traps nerves between them. Compression by the pudendal nerve as it passes under the piriformis muscle from nervemed.com. Compression of the pudendal nerve as it travels across the arbitrator foramen within the Alcock's canal, nervemed.com. Compression of the pudendal nerve by irritation of the impar ganglion on the internal surface of the cocks, nervemed.com. Compression of the pudendal nerve upon exit from the Alcock's canal and branching in the perineum between the legs, nervemed.com. Compression of pudendal nerve by sacroiliac joint dysfunction. Clinically, somebody has observed that the symptoms of pudendal neuralgia are often associated with sacroiliac joint dysfunction, and they propose that the pudendal nerve could be comprised by dysfunction of the sacroiliac joint. Potential mechanisms could involve soft tissue damage resulting in stiffening of fibrotic scar tissue at the sacroiliac joint, causing sacroiliac joint malalignment. The putative reasoning suggests that if physical stress causes the sacrum to nudate or the ilium to posteriorly rotate, tension is placed on the nerve as it moves between the sacrospinous and sacrotuberous ligaments. That was from PeterDornanPhysio.com. Of particular interest, one perineal branch of the nerve, the inferior pudendal long scrotal nerve, curves below and in front of the scule tuberosity, pierces the fascia lata, and runs to the skin of the scrotum in the male and the labium majus in the female, causing scrotal pain and labia pain being one of the consistent symptoms of this condition. So basically, it's saying that's the perineal branch, which basically the perineal branch just does branch into either the male scrotum or the female labia. That was from PeterDornanPhysio.com. Several of the lumbar nerves, particularly the posterofemoral cutaneous nerve, inferior gluteal nerve, the tibial nerve, the common perineal nerve, and the perforating cutaneous nerve, can be referred from injury to the lumbar area or from chronic sacroiliac joint damage. Compression of the cluneal nerve uh, which is the nerve that supplies the superficial area of the buttocks area, and that was from Dr. Lee Dellen. And so basically, there's also other causes. Like I think I mentioned this, but the piriformis muscle can mimic. Some things can mimic pudendal nerve entrapment or neuralgia, like the piriformis muscle syndrome or sacroiliac joint dysfunction, or if you have a compression of the genital femoral nerve or ilioinguinal nerve. So those need to all be ruled out, as well as other causes. So complete tests should be done by all the specialists involved, urologists, especially if there's any areas, just to rule those other areas out. If you're having urinary symptoms or whatever symptoms pertain to you, you should have a specialist kind of rule out anything else also. Okay, also, one problem that I've had in the past, if you've gone to your specialist and they've ruled out, especially if they've ruled out, everything, like from your urologist doing cystoscopy and gastroenterologist, and they can't find anything wrong with you. They just say you have chronic non-bacterial prostatitis, or, that you're not really getting any help. If you want to, try to get diagnosed with pudendal nerve entrapment, the way I was actually diagnosed is with my sports medicine doctor, or also called orthopedic doctors. And they're familiar with pudendal neuralgia and pudendal nerve entrapment because I see it a lot with bicyclists because they injure their perineum a lot. They're bicycling. Anyways, there's a website you can go to do a search for a local sports medicine orthopedic doctor who can help to maybe possibly diagnose or treat you, getting the right test done. The website for that is www.am as in Mary, S as in Sam, S as in Sam, M as in Mary.org. That's www.amssm.org. And you click on Find a Doc, and you can search by your state. Just put in your abbreviation for your state instead of the last name. And I would recommend calling their offices to find one in your area who can help you with that. They also are helpful with, trying to diagnose your sacroiliac joint dysfunction or piriformis syndrome with lower back problems. You can also call a number to find one in your area, which is 913-327-1415. That's 913-327-1415. You can also try calling urologists, especially ones that specialize in pelvic floor dysfunction, and see if they have any doctors there who are familiar with treating and diagnosing pudendal neuralgia, pudendal nerve entrapment. I know there is one in Wake Forest, where I live in North Carolina, named Robert Evans. I don't know as far as any other urologists that are able to besides Dr. Analock, as far as urologists go, but you should be a good idea to call their office to see if they know that, if they do. Anyways, this is just helpful for those who are having trouble and they can't wait 8 months to get into a specialist for P&E like Dr. Hibner or somewhere else. And you need to get, diagnosed and treat it right away, which is important, but make sure you see all the right specialists and get all the right tests to make sure you rule out everything. Also, it's important because it's also a process of, exclusion and ruling out stuff, by working with all these specialists. But anyways, just a tip. Thanks. One last thing, please consult your doctor before taking any kind of action, and always take the advice of your doctor over myself. And see the appropriate specialist for whatever condition you have. And this presentation is by no means intended to be a substitute for any kind of medical advice, but just my opinions and also observations on the anatomy. Also, diagnosis, exact diagnosis of what your problem is and where it's at is key before surgery. And I recommend highly to get a Dr. Hollis Potter MRI in New York City from the Special Hospital for Special Surgery Center. Um, as many of her findings have been confirmed after surgery. But diagnosis is key, and it's harmless to get an MRI before surgery. And it's important to know exactly which type of surgery and which approach you need before surgery. And also, don't give up. There's always hope. Never ever give up. Things are getting better. Things are improving, and more awareness is being brought.
Don't you ever stop, give it all you got. One day you will end up on top. There is no excuse, don't ever refuse. Keep on trying, but you got to lose. Inside you're dying, inside you're crying. But one day you will be smiling, with lots of chance to be enhanced. So you hop and start to dance, and start to dance, and start to dance, and start to dance. There is always, always hope, always hope, always hope. Some might say that there is no possible way, possible way. There is always, always hope, always hope, always hope. 'Cause nothing is impossible, impossible. There is always hope, always hope. There is always hope, even when you feel like you've gotten to the end of your rope. If the sky is gray and you start to feel like just giving up and running away, never give it up. Try to suck it up, even during times that are really tough. Just after the rain, the sun comes your way. Soon after we'll leave all of your pain, all of your pain, all of your pain, all of your pain. There is always, always hope, always hope, always hope. Some might say that there is no possible way, possible way. There is always, always hope, always hope, always hope. 'Cause nothing is impossible, impossible. There is always hope, always hope. There's always, always hope. There's always, always hope.